Thank you for joining us. We have just started the webinar. Today is Thursday, January 29th, 2026. This is the Implementing the Master Plan for Aging in California Together, or IMPACT, IMPACT Stakeholder Advisory Committee meeting. Again, thank you for joining us this Thursday morning. We welcome you to this virtual space. I'm going to go over, I'm going to introduce myself. I am Carol DeAndres. I am the Stakeholder Engagement Manager for the Master Plan for Aging, MPA, at the California Department of Aging, or CDA. Next slide. I want to go over our meeting accessibility features today. We have American Sign Language, so we thank our ASL interpreters for being with us today. We have closed captioning. You can engage that with the CC icon. It's at the bottom of my toolbar. If you don't see it, it might be under your More button, those three dots. And please go ahead and show captions and view a full transcript. Next slide. Today's meeting is being recorded, and all the meeting materials, agenda, and slides will be posted to the CalHHS, the California Health and Human Services, CalHHS agency webpage for the IMPACT meeting. And committee members and guests, if you haven't already, please check your name display. We have a generic IMPACT member and guest on it now, but we'd love to know your name. So please change your name. And if you need any assistance with that, staff's happy to help. Next slide. Our operations. The chat function is enabled for IMPACT committee members and staff supporting this webinar to share out meeting related resources and information. And the public may view that content in the chat. The question and answer function or the chat is not enabled for participants, but do note we do have a public comment period towards the end of the agenda where we welcome your comments. Of course, at any time, you can send a written comment to our Engage email box, which is engage, ENGAGE, at aging.ca.gov. Just quick logistics on the public comment period. Attendees joining by phone, you would press *9. That would indicate to us that you would wish to leave a comment. And attendees via the Zoom webinar, you have a raised hand icon, so you can utilize that. And do note, we will have 2 minutes per comment. We have many people on the line today, so we do want to ensure that we have enough time for everyone, so we ask you to abide by the 2 minutes. But of course, at any time, you can send a written comment to us at the Engage email box. Let me give you that again. Engage, ENGAGE, at aging.ca.gov. The purpose of the Implementing the Master Plan for Aging, MPA, in California Together, IMPACT, IMPACT Stakeholder Committee, is to advise the California Health and Human Services Agency, CalHHS, on the implementation of the Master Plan for Aging, focusing on accountability, outcomes, and continuous improvement towards the plan's 5 bold goals for 2030. And we wouldn't be able to fulfill this purpose without our esteemed committee members who do give of their time and their expertise freely to advance the Master Plan for Aging. These are subject matter experts in their field, and we are so appreciative of the time and expertise that they give to us. So thank you very much to all of our IMPACT committee members. Just a quick overview of our agenda. It is packed, so I will get through it so you can get to the meat of this webinar. We have opening remarks from our director, Susan DeMorris. Then we will go over our Master Plan for Aging 5th annual report, going into our current state and federal landscapes. Committee discussion, of course, throughout, and California's commitment to the MPA, and the MPA midpoint evaluation, public comment, and then we will be closed out. So without further ado, please go ahead, Susan. Thank you very much.
Carol, thank you so much for walking us through the steps for a successful meeting and highlighting the heart of the Impact Committee, our members. So welcome back to all of our Impact Committee members, and a very special welcome to our newest addition, Dr. Zia Aga, who joins us today. Zia, welcome. Zia is with the Gary and Mary West Foundation and West Health, and has been part of the Master Plan for Aging since the very beginning, and is a key leader in the national movement to bring MPAs and multi-sector plans to now nearly 26 states across the country. And we tapped Zia to join at this moment because they've been leading at West Health and the Gary and Mary West Foundation. They've been leading some amazing work around Alzheimer's disease, dementia, and dementia caregiving, as well as older adult behavioral health. And those were gaps that we had in our membership, but also those are definitely trend areas for the aging and disability networks. So we welcome you, Zia. We welcome your expertise. I don't know if you'd like to share a few comments as you join us today.
No, thank you so much, Susan, and gratitude for your leadership and for the team. It just seems like it was yesterday, 5 years ago, when we launched this master plan, and I was obviously participating in some of those activities. Excited to review the report and excited to contribute. So thank you for the opportunity.
Wonderful. Welcome. Welcome. And, you mentioned how fast time flies, and I did want to reflect because this is our 5th annual report that Sarah will be talking about in just a minute here, but I can liken it to current times because I well remember the press event we had on January 6th, 2021, when we thought the world was going to stop and learn about California's Master Plan for Aging. And we didn't realize that the world did stop because there was a riot at the U.S. Capitol that happened concurrently to our press event and overshadowed the release of the master plan. And at that time, I was a stakeholder, and I remember thinking, all this work, and now it's we're going to lose attention, we're going to lose focus, and I was discouraged about the work of the plan. And I never in my wildest dreams imagined that 5 years later, we'd be here today with all of you with continuous momentum. We haven't let any distractions, and there have been hundreds, if not thousands, in the last 5 years that could have been detours and distractions from our work. And not one of us has let that happen. And you'll hear today from Secretary Johnson and Richard Figueroa in the governor's office. So every part of government, our stakeholder community, and most importantly, our consumers have not been deterred by things happening around us. So glad to be here today for the 5th annual report. And Sarah, I'm going to turn it over to you, Sarah Steenhausen, our Deputy Director for the Division of Policy Research and Engagement. And Sarah's going to provide an overview of today's report, released just moments ago.
Thank you so much, Susan. I did want to ask, though, we have Secretary Johnson and Fig here, so I didn't know if they would want to go before.
I have time. I'm here for a bit, so glad to stay on schedule here. Please proceed.
Okay, great. Thank you so much. Well, thank you, Susan. It is a wonderful, terrific opportunity to provide an overview of the 5th annual MPA report. I think it's important to underscore that the progress of the MPA continues to rely on partnerships from our state partners, local colleagues, the legislature, stakeholders like all of you, and of course the private sector. So while we're proud today to recognize the progress, we also recognize that there is much work remaining and we cannot afford to slow down. So now I'm just going to take a few moments to summarize a few of the achievements, which you can find more info about in the MPA implementation tracker, which is live and online. First, goal 1, housing for all ages and stages. So we all know that access to affordable and accessible housing and transportation is critical to ensuring that older adults and people with disabilities can live and thrive at home and in the community. In fact, this issue continues to be elevated by our Age and Disability Lived Experience Advisory Board, as well as our other stakeholder committees. So this past year, we have some notable accomplishments. First, the Department of Healthcare Services launched the Medi-Cal Transitional Rent Program, coupled with the Behavioral Health Services Act housing intervention. Together, this has created an unprecedented opportunity for housing stability as part of the healthcare delivery system. Second, the Community Care Expansion Program, administered by the Department of Social Services, funds the acquisition, construction, and rehabilitation of adult and residential care facilities. This program alone is anticipated to build or preserve 7,000 beds or units in these settings. And third, in the area of transportation, the California State Transportation Agency completed the 2025 State and Local Transportation Needs Assessment, which includes a dedicated focus on accessibility and mobility for older adults and people with disabilities. We have heard so loud and clear from our Disability and Aging Community Living Advisory Committee and particularly the Subcommittee on Transportation that there is so much work to do in the area of transportation. And we're really proud of this growing partnership with the California State Transportation Agency, and we're going to continue to work with our state partners and stakeholders in improving access to these vital services. Okay, I've got to get some water here. And finally, we are really proud to see communities across California that are actively preparing for the state's growing aging population. The local Aging and Disability Action Planning Grant Program has supported 30 communities across California in creating actionable plans tailored to meet local needs. And I do want to call out that that grant program was funded in the 2022-23 budget, and it was the result of an advocacy request that AARP and several other stakeholders requested from the legislature. So were it not for that advocacy and that support, we would not have been able to achieve in launching that really successful program. So thank you. Now I'm going to move into goal 2, which is Health Reimagined. We continue to see progress in providing a whole person care approach through the CalAIM initiative. In fact, DHCS has invested more than $1.3 billion to strengthen the capacity of community-based organizations, counties, and tribes to deliver enhanced care management and community supports. These services are so important to supporting older adults and people with disabilities at home and in the community. And really, they recognize that social determinants are critical to a person's health. Since last year alone, ECM and community supports enrollment has grown by over 60%. And we look forward to continue working with our state and local partners in determining how we can ensure that older adults and people with disabilities are receiving these services, especially when they are entitled to be receiving them. We also continue to uplift the needs of the people who are living in our rural communities. We are hearing a lot about this more and more in our stakeholder committees, and we recognize the importance of addressing the gaps in services in those communities. This year, CDA provided input to the Department of Healthcare Access and Information as part of its Rural Health Transformation Initiative. And HCI was awarded $233 million for fiscal year 2026 to support rural and frontier communities across the state. We really look forward to being part of this implementation process as part of the Master Plan for Aging. Goal 2 also includes an important focus on Alzheimer's disease and improving early detection. Several MPA initiatives seek to support the needs of people living with Alzheimer's disease and related conditions. We're proud to note that in 2025, Dementia Care Aware, led by UCSF, received support from the West Health Institute to continue improving early detection of dementia across the state, especially in underserved populations. Additionally, the Department of Public Health funded 13 county-level Healthy Brain Initiative projects that engage and educate the public, strengthen policies and partnerships, and build the workforce necessary to promote cognitive health across the state. Goal 3, inclusion and equity, not isolation. The MPA continues to uplift the importance of lifelong opportunities for work, volunteering, and social engagement, while also protecting older adults and people with disabilities from abuse, neglect, and exploitation, all while embedding equity throughout all 5 goals of the MPA. Never before has this been so critical, especially when we see older immigrants experiencing fear and loss due to the federal government's immigration actions. With many older adults facing increasing isolation and loneliness, the MPA plays an important role in promoting opportunities to fight discrimination and engage in the community. Importantly, the MPA also focuses on improving and streamlining access to services. Across the state and through our stakeholder committees, we continue to hear the importance of having a statewide source of information to help people navigate the fragmented delivery system. So while we are continuing to build out our vision for a no wrong door approach to navigation, we're really excited to announce that this spring, California will launch its first statewide consumer website. It's going to be called Age Well California. It will provide information on statewide programs and services for older adults, people with disabilities, and caregivers. This is the first step, but not the only step. It's a first step towards a no wrong door approach to service delivery, in partnership, of course, with valuable local partners through our aging and disability resource connections, as well as other services throughout the state. I want to talk about the importance of bridging aging and disability networks, which is really central to MPA Goal 3. Last year, we celebrated the 35th anniversary of the Americans with Disabilities Act. And as part of the MPA, we continue state level efforts to promote the important values embedded within the ADA. As an example, CDA and the Department of Developmental Services are co-leading the Bridging Aging and Disability Networks initiative, which seeks to strengthen the collaboration between disability and aging networks to better support individuals aging with intellectual and developmental disabilities and support their caregivers. As part of this initiative, we're going to include the development of model curriculum to train caregivers on the needs of individuals aging with developmental disabilities. Now, moving to Goal 4, caregiving that works. We know how vital our direct care workforce is to all that we do. In fact, nothing could be done at home and in the community without both our paid direct care workforce and our unpaid family caregivers. So across the California Health and Human Services Agency and in partnership with the Labor and Workforce Development Agency, many efforts are underway to both build the workforce pipeline and support the current direct care workforce, including family caregivers. As an example, the California Employment Development Department and Labor and Workforce Development Agency were awarded $2 million in grants last year to expand training opportunities, to build job-ready skills, and connect people to valuable allied health careers, such as medical assistants, certified nursing assistants, medical technicians, and licensed vocational nurses. Additionally, the Department of Aging received a Federal Administration for Community Living grant to improve the awareness, navigation, and educational opportunities for California's caregivers, which is in alignment with the national strategy to support family caregivers. This initiative, called CalCares, builds off our CalGrows initiatives and aims to increase awareness about the value and needs of caregivers and increase access to caregiver training, including those caring for individuals with intellectual and developmental disabilities. And now moving to Goal 5, affording aging. As the cost of living continues to rise in California, it's more important than ever that we address the affordability crisis impacting older adults and people with disabilities, which includes how we finance and pay for long-term services and supports. This continues to be the focus of our long-term services and supports financing initiative, and we look forward to releasing that full body of work later this year. But I want to provide a few examples of notable progress in Goal 5 in the year 2025. First, California's savings program for individuals with disabilities. It's called CalAble. It achieved several milestones last year, including enhancing access to the program through a launch of a public awareness campaign and enhancing language access to this service. Additionally, through the 2024-25 Budget Act, California invested $5 million over 5 years to expand our guaranteed income pilot program with older adults as a priority population. This program is being piloted in partnership with the Housing Authority of the County of San Joaquin and will be administered by the Department of Social Services, providing $1,200 per month for 12 months to 240 adults age 60 and over who reside in that county and who are currently on the wait list for housing choice vouchers or project-based vouchers. We look forward to seeing the results of that pilot project. And finally, with food security and benefits impacted by the 2025 federal government shutdown, Governor Newsom fast-tracked up to $80 million in state funds and deployed the California National Guard and California volunteers to support food banks across the state. It is so critical in times like this that our state continued to be fast and responsive in addressing the critical nutrition needs of our populations. But before we end, I wanted to thank our philanthropic partners who have supported the MPA since its inception, collectively investing over $5 million to advance the MPA. So I want to call out, of course, the support of Archdown Foundation, the California Healthcare Foundation, the Gary and Mary West Foundation, May and Stanley Smith Charitable Trust, MetaFund, the Rosalind and Arthur Gilbert Foundation, and the SCAN Foundation, as well as the WITH Foundation, who has supported us on some services for people with developmental disabilities. And finally, a note to our stakeholder advisory committees, all 6 of these committees, as well as our lived experience advisory board. I cannot understate the importance of your voices and the voices of our 5 other committees in providing input and feedback that helps us better understand what is occurring throughout the state, how we can improve, and where reform is needed. It's not always easy to see where your voice makes a difference, but the advocacy and partnership you bring truly does make a difference. So in conclusion, the MPA continues to provide a vision, a focus, and a platform for collaboration. And in challenging times, it enables us to continue elevating the vital needs of this population. These next 5 years, we intend to continue working closely with our state partners, local partners, the legislature, and stakeholders to advance the 5 bold goals with urgency and intentionality. Thank you so much.
Sarah, thank you very much for so succinctly summarizing the phenomenal work that happened in 2025 and continues today. And with that, I'm just thrilled to welcome back the California Health and Human Service Agency Secretary, Kim Johnson, who has joined every impact meeting that's been held since she was appointed by Governor Newsom into this role, and continues to lead a huge department with a huge agency with huge impact during very consequential times for our state and nation. Welcome, Secretary.
Thank you so much, Director, and thank you all for being here. Just first, tremendous gratitude for each of you in this journey together, and phenomenal to be in community with you amongst a group of allies who are intentional about their focus and steadfast to the point. So kind of happy halfway point maybe of the master plan itself, and just phenomenal to see the progress that you all have made to date. I'm glad to have been on the journey since the beginning as well, and just appreciate the director's opening comments about what 5 years this has been, and to make progress within that context, and to use opportunities that we are challenged with as we are today as also opportunities to make significant change and progress, and even double down on the efforts we're making. Glad to be a part of it with you. So just thank you to all the advisory committee members. Thank you to all of those who are participating with us in this space. And congratulations on 5 years of phenomenal impact. I want to start with just again kind of naming the moment we're in, and particularly the challenges that we are having with the federal government and level, and how that really is impacting our progress that we are making in some spaces. And there's been some reference to that in these opening remarks already, whether it's related to immigrants and the very targeted focus that the federal government has had there, whether it's related to the improper use of data, whether it's related to real significant changes with civil rights, equity, but also really looking at challenges to the access to care, whether we're talking about health or human services in the array, right? We have been certainly impacted by the volume and the way policy that's been coming at us in this space. And we are certainly using this moment to, again, educate on the value and success of our programs. We are fighting back, and a third of the litigation that the Attorney General has put forward on our behalf has been focused on health and human services. And we are winning. But we also have a real challenge in front of us in terms of the implementation of the provisions of H.R. 1, as referenced by the president as the One Big Beautiful Bill Act, which we know is, again, going to have tremendous impact on those who can access and who would otherwise be eligible for both Medi-Cal and CalFresh services, as well as on our fiscal situation here in the state of California. So I do want to say to you, and also invite you, that we are holding kind of a regular cadence of conversations, if you will, of informational opportunities to learn about how we are mitigating against the harm of those provisions of H.R. 1, what efforts we are taking, utilizing the feedback of community, and utilizing things like data and technology to try to minimize who is going to be impacted, that we can otherwise qualify for things like work or community engagement requirements, those kinds of things, but really working in partnership with all of you on how we're communicating these changes to those who are impacted, and again, what we can do going forward. So a lot of work happening on that front. We have a webinar series. We'll put it in the chat that we do encourage you to continue to use as a way to keep up on the efforts across California Health and Human Services and its departments on those fronts going forward. But there are different kind of time horizons for each of the provisions of policy and where they're coming, so you can also kind of stay abreast in that space too. And the Department of Social Services and Healthcare Services are doing a lot also in terms of opportunities to engage on these topics. So really, again, invite and encourage. It's a moment where we need each other to work together on your best thoughts and innovations on how we're going together in those spaces. I also, though, you say it's an opportunity for education because you may have also been tracking quite a bit of conversation, if you will, particularly on social media related to program integrity at the federal level, where just this week we've seen a clip from Dr. Oz, the CMS administrator, that's kind of questioning the intent of our in-home supportive services program. It's kind of he's outright suggesting that why is there such a program? And we want to answer that question. So I do just really invite and encourage you all, as we are going to continue to not only respond with information and help people understand the phenomenal investment home and community-based services is as a cost saver, as a way to keep people in their homes and connected, and the ways in which we have grown that program to the benefits of our communities and the state as a whole. So I would say as a country as a whole, consistent also, I would say, with the federal administration's direction. So I just again lift that up because again, we are seeing disinformation in mass, flooding of the zone, as has been referenced, and we want to also flood the zone with the correct information, with information to educate people on the value and benefit of these services and why we have invested, as we have put forward in things like our master plan for aging, these efforts going forward. So again, we are responding. We are also proactively continuing that work. And I know you all are partners in it with us. So just, again, tremendous appreciation for that partnership, and especially now. Some of those provisions have also had an impact on our own kind of state revenues and budget, whether it's tariff policy in the last year or otherwise. So as a whole, when we turn to our own state budget, we're looking at, in the January 10 governor's budget proposal, about a $2.9 billion deficit projected. There are some provisions in the governor's state budget related to in-home supportive services, as an example, with a proposed elimination of the provider backup registry, some changes to administration, making it align inefficiencies with Medi-Cal, and some pieces around the growth hours that I'm glad to answer questions about. We also, though, I want to draw your attention to that we have a proposed special fund augmentation to the state's health insurance counseling and advocacy program, also known as HICAP, to provide more support in consumer-oriented Medicare counseling and education services. So that's a good, positive thing. And we do have other good, positive things to recognize, inclusive of just last month, the award of $233.6 million for the federal fiscal year 2026 for the Rural Health Transformation Program, which is looking to expand access to care and strengthen the workforce in rural and frontier communities across the state. And the Healthcare Access and Information, or HCI department, is leading those efforts, which again is intended to strengthen and shore up the efforts that are happening in local, regional, rural communities in those spaces. So those are a couple of positive points I want to point you to. And then also want to say that it's a proposal. As we all know, this is the January proposal. We have the May revision, which again, I know all of you will continue to inform to ensure that we're continuing to invest where we need to going forward. So just a few quick budget updates. The other place I wanted to highlight and lift up is related to behavioral health and the phenomenal transformation that we have undertaken with all of your support, the investments that we've made, not only in the kind of service array to ensure that anyone, anytime, any place can get access to that full continuum of behavioral health resources that they need, but also in the workforce, also in the infrastructure with things like the Behavioral Health Continuum Infrastructure Program, the Healthcare Services Department is leading. And we're seeing these places and settings open. So we're seeing in real time community capacity expanding. We're seeing, again, people getting their needs met in various ways and capacity. So we have just months now away from having the first integrated county behavioral health plan that every single county across the state will be publishing, if you will, completing July 1. And again, want to ensure that you are all both having those opportunities locally to ensure that those plans represent and address any gaps for older adults and those with disabilities, and that we're intentional about thinking about that population in every step of the way as we are looking at this phenomenal opportunity to implement Prop 1, both on the prevention side as well as the intervention and beyond. So again, a lot happening in the behavioral health space that we again encourage and invite you to go forward with. I had the great opportunity to join Director DeMorris a couple of weeks ago with the first partner in the governor in San Francisco, where we were kind of softly launching the California Love, California Strong campaign of the first partners, but we were doing that at the Lady Shah Center. Senior Center in San Francisco. And we had well over 100 older adults there teaching us to line dance, doing Tai Chi, just celebrating each other in community, getting access to that food security, food resources that we were happy to distribute. Bottom line is these were the individuals that received the adult day services, that are connected again with community, that are doing the things that we are asking them to do and keeping themselves healthy and safe and connecting. So that is always, those are always great days in community, and it was just full of joy and recognition of the phenomenal work that you all are doing as an example. So I just again want to appreciate the progress that this group has made, and that we need each other in this moment to do more together, again, with some strong headwinds along the way in this particular moment. So I'm glad with that to answer a couple of questions if anyone has them, or comments that you might have while I'm here.
Terrific. Thank you so much, Secretary. And we will take a couple of questions or comments, observations from anybody, any members of the Impact Committee. I'm looking for any raised hands.
I'm happy to break the ice.
Wonderful, please.
Hi, Secretary. Thank you so much for joining us. Appreciate your comments today. And I think I first just want to say at the outset that we really stand with the administration against the baseless federal attacks this week on IHSS. And I really want to say that, Justice and Aging, and I'm sure I can speak for everyone here on the committee, that we're here as partners to work with you and the administration to ensure that we fight back against that we continue to have a robust IHSS program that really meets the needs of Californians. Like you said, home and community-based services is the core of keeping people at home in their community. It's also cheaper for the state because we know the alternative of institutionalization or not getting the care you need ultimately costs the state much more. And so I just want to say that we are here with you on that, and anything that we can do to help bolster the program. I say that with the then sort of disappointment on some of the proposed budget solutions in the January budget, which again recognize that we're at the beginning of a conversation, and so look forward to continuing to discuss this. But the proposals around IHSS, we are really concerned specifically around the shift of the cost to the counties, that is ultimately going to potentially have an impact of reduced hours on consumers. And that is not the direction we need to be going in. We know that there is such incredible need in the state, and having sort of policies in place that are going to reduce people's hours and reduce the amount of hours that workers have to work is not the direction we need to be going in. And we stand again with you to sort of figure out what is the alternative solution here, to recognizing that there is the sort of fiscal impact to the state, but what can we be doing? How can we be supporting you on new and sustainable revenue opportunities to sort of continue to be able to build and grow the program? Because again, we know the need is out there. And so I just, again, we are with you on building up the program and making it, continuing for it to be the model in the nation. And then on the other hand, I'll also just the mention of the attacks on immigrant communities, both from HR1 and what that means at the state level. we were really disappointed to see that the 200,000 lawfully present immigrants who are refugees, asylees, victim of crime, being moved out of full scope Medi-Cal and into restricted scope Medi-Cal. We see that as really, it's going to be a huge change for so many people and their families, specifically for older adults who are also in that category losing their Medicare coverage. They will also no longer have access to Medi-Cal coverage and be, completely left with, uninsured essentially. And so we encourage the state again to consider revenue options, ways to mitigate the harm, keeping people fully covered, so we don't end up further increasing our uninsured population, which then has other trickle-down effects on our whole society. So again, thank you so much for being here and look forward to working with you this year.
Thank you very much for those comments, and absolutely accept the invitation to partner in lifting up the success of IHSS, and appreciate you lifting up those two other kind of budget proposals and considerations. And a couple things I'll just say very quickly is that you've seen and heard, right, both in terms of in-home supportive services, Medi-Cal, and developmental services. These are three areas where we have seen very significant growth, both to your point, based on the need, and in some places intentional growth, right, with our home and community-based services. The challenge is that growth is outpacing our revenues. And so that is the challenge that we all have together in trying to figure out how to solve and address and have a balanced budget given that reality. And also to your point about some of the proposals, again, HR1, as I outlined, has significant impacts to our state. And to your point, some of those impacts we are not, quote unquote, backfilling, right, in terms of having other state solutions in this January 10 proposal, but completely appreciate it's a continued conversation. And we're going to have to figure that out because, again, the impact of the loss across our systems is so significant that's just a simple backfill isn't an option, an opportunity, but how we're strategically thinking, and in some cases needing to reimagine services we want to do with you together. So appreciate continued conversations on those fronts.
Thanks. Time for one more, and then we'll move to Richard Figueroa. If I don't see a hand raised, Melinda.
Tiffany's
Oh,
hand
Tiffany.
raised.
Okay,
Yep.
there you go, Tiffany.
I have one. Okay, just to appreciate it, Secretary Johnson and Director DeMores for the ability to be in community with you all this morning. Just wanted to echo comments made by my colleague Yasmin over at Justice and Aging. Just wanted to underscore for the IHSS program, and of course, appreciate the pushback and the response that you guys will be giving to the federal government. But respectfully, it feels like every time we make investments into the IHSS program, our state comes in and then kind of penalize us for our growth. It feels like no matter if the budget is good, bad, or indifferent, the IHSS program always gets hit, no matter what. And I get it that our program is growing, but we also save money. So it feels a little disheartening when we hear that, we're making all these investments into the program, and at the same time we're taking it back, like eliminating the provider backup system. So just really want to make sure that as we continue to think about the IHSS program and we think about the investments made, that we're doing it from a thoughtful position, and we're not then kind of taken away in other areas, because we do need a solid program to assist our communities. And then related to HR1, just wanted to highlight and underscore the importance of the workforce at the county level, and ensuring that we have a workforce that stands ready and willing to make sure that we understand work requirements, we understand everything that comes with it, and that we're able to engage with the consumer sitting across from those workers to be able to better serve them, so that we can make sure that they stay enrolled and receive services, as well as receive their food benefits for them and their families. So just really wanted to underscore and uplift the workforce. We've seen our workforce come through when it was ACA. We've had our workforce come through with the unwinding of the pandemic. Our eligibility workers, our social workers are the backbone to keep things running. And so just wanted to underscore and uplift the workforce. Thank you so much.
Thank you so much. And thank you to the workforce. And thank you for your letters too. I just want to tell all of you who write letters in the budget, we read them. we might not respond to every email, but I just want you to know we do read them. And appreciate you all weighing in on the places that you think are most meaningful. So I know that there's a very focused ask in HR1 related to workforce. So we're tracking that. And again, appreciate that we have to figure out ways utilizing that relationship that people have to, again, get them connected to community engagement opportunities where that is an opportunity. And again, figure out how we're mitigating the harm of any reduced access. So again, appreciate you lifting that up.
Thank you, Secretary, for joining us. You're, of course, welcome to stay as long as you wish, and you're excused. You've been very generous with your time this morning. We'll now move, if Richard Figueroa is fantastic, Fig, welcome to you. We're delighted you also can join us today as our Deputy Cabinet Secretary in the Office of the Governor, our point person for all things in the Office of the Governor, keeping on top of everything related to health and human services, and being one of the early architects of the master plan for aging. So Fig, welcome to the Impact Committee meeting this morning.
Thank you so much. Can you hear me? Am I off mute? Okay, thank goodness. It's always very difficult to follow Secretary Johnson and the folks that are before us who are in this fight in a very deep and committed way. You know, the past 2 weeks have been especially hard watching what's happening in Minnesota, kind of what has already been discussed earlier. It's a state that shares some of the same core values that we do in California. Obviously, many of you on this committee provide direct services and support to community members who are being targeted by federal policies in these uncertain times. We have your backs. We're up to 54 lawsuits at last count, I think. That's just in the span of a year. About 1/3 of those, unfortunately, are in the HHS space, and it's just very unfortunate that our communities are being targeted in this way. And California is fighting back using all the tools and resources at our disposal. Unfortunately, as we have seen in Minnesota, the attacks, the issue around fraud, waste, and abuse has morphed into attacks on entire communities. And we've seen that in California just in the last couple days. And as noted earlier, has moved even from the general notion of or title of waste, fraud, and abuse to attack on the need for the benefits themselves. So it's just this constantly shifting atmosphere here that we are trying to combat. And again, it was noted earlier, obviously we're very supportive of home and community-based services. That is what we should be doing, is maintaining people in their homes, aging in place. And it's been very, very surprising to see such a strong attack on services that we believe are necessary and important to sustain people in the community. So again, we're in it together. Thank you for all that you're doing at the community level and with your collective voices. You already kind of heard from the secretary already, on the budget. I think, it was kind of in a way a workload budget in a way. We were dealing with some very, very large looking at some very, very large budget deficits. And so we were able to identify some additional revenues that we wouldn't have to make major cuts, but we also can't afford major new initiatives. So it's kind of a little bit more of a workload budget. But it does rely on stronger than expected revenue to protect some of the previous investments we've made in education and healthcare. Obviously, the Legislative Analyst's Office, which does non-partisan fiscal analyses, has a little bit different take than we do on what the budget picture is. And so that I think those are all, continuing kind of cautionary flags for the governor and this administration as we work with the legislature on what to do. And as you know, the governor's budget, Secretary Johnson said, want to work with you. It's a proposal, right? And we come out with our structure in January. We gave it to the legislature, stakeholders like yourselves, obviously, just like the secretary. I saw the letter. We call them NASCAR letters because like the NASCAR cars have all those like stickers on them and stuff representing different supporters or sponsors. So we do see those letters. I do read them. I'd like to I usually say thank you to whoever the lead person that sent it to me. I can't send thank you to everybody on the letters. But we do read them. So we can kind of see where, kind of what the community reaction is and kind of the other things that people want us to respond to that we can expect to respond to during the budget process. And as the Secretary said, we'll continue the conversation going into May. And we know the legislature and our stakeholders are very important partners. And so I'm sure you'll be communicating with the budget committees along the way. As was noted, I've kind of been here since the beginning, even before the beginning, in a way. I was at I think Sarah at the time you were at Scan maybe and had a big conference where I was up at the stage when we had like videos. You were showing videos of the gubernatorial candidates at the time committing to do a master plan on aging, and I was standing up there thinking, boy, and I knew already kind of I wanted to have this gig. And I knew I'd be applying. And so I was running up there. Obviously, Sarah wouldn't have known this, or Scan folks wouldn't have known this, or the other sponsors. But I was thinking in my head, gee, I wonder if I'm going to be the one doing this. And here we are 8 years later, and certainly 5 years into the plan, and something we're very, very proud of. It was an early priority. It's something the governor mentioned in his State of the State. And we're kind of able to get that, kicked off into both this and the Alzheimer's work kind of collectively, concurrently, kind of together. I think, you've all collectively had a great opportunity to, in terms of your ongoing participation in the work, have had an opportunity to contribute to what is going to be released. Obviously, still a long way to go, but it really is remarkable how far we've come in 5 short years. The work that we've all done collectively, I think, and again, the secretary and director can talk about this some more at some other point, necessarily, but this has been a model for how other states have decided they want to approach this issue. And again, when we did this, you know, back when, 8 years ago or so, when we started this process, we really hadn't done anything um, since the early 2000s, and what Reverend Gray Davis did towards what they called aging with dignity back then, about, gosh, 25 years ago now. And so this was a very, very major next step. And of course, we've all aged as a society. I sure the heck know I have over the last 25 years. And it was a very appropriate time to address. But like moving these massive systems and huge populations just isn't simple. And again, I want to commend all you folks for kind of keeping the plan dynamic and ever evolving. You continue to hold us to the task. We know that I mean, because of your advocacy and oversight, we won't lose focus, and this won't be on a back burner. I think you've been with us through thick or thin. We have these like crazy revenue cycles that we have to deal with that do allow us to make one-time investments, and other times have to kind of cut back on others over a longer period of time. And you've kind of stuck there with us, and the department and the agency have been very, very creative in trying to, like, you call blend and braid these various resources, federal, foundation, state resources, and to kind of continue to kind of move the ball forward, and not just in the HHS area, but across the entire spectrum of elements of the master plan for aging. So, we do keep track of these investments. Some say it might be high as $1 billion over the course of the plan. When you look at like things like park passes and transportation to disaster recovery. So looking at the broad swath, the broad scope of things that we've been working on. But again, we have seen funding booms and busts. I mean, I guess if funding and investment are like the only measure that we're going to be testing ourselves against, we're probably missing a big part of what matters, which is really setting the legacy for the future. Obviously, there'll be a new governor coming in, but we'll have a really good template to work from, and hopefully can continue this work. And again, you folks will be able to keep whoever the new person is to task, and you're going to have a unique opportunity to kind of, this will be a person that won't have come in expecting to do a master plan for aging. That will really need your educational efforts to kind of demonstrate how important this is to kind of continue this work, who will have to kind of bring that person up to speed. And some of us may or may not be around because lots of personnel changes during the process. And so really it's going to be incumbent upon the folks that are listening and the public to really educate the incoming governor. Governor always says he's like a milk carton. He has an expiration date at this point. And so we really, really relying on you to kind of do this. I do think just to kind of make a couple points about, the kind of things that are kind of like legacy building here. We have 100 communities now that are now active in the AERP Age-Friendly Network. We have 20 local organizations that have stepped forward to receive 4 million in state funding to support the development of local aging and disability action plans in 30 communities, including some of you on this committee. This group and others are focused on equity, elder and disability justice, community living, and Alzheimer's, and inform our thinking. And again, serve as a pipeline for new leaders and new voices. And as I mentioned before, that $1 billion, depending on how you count, it's across it like housing, transportation, workforce development, and have really kind of pulled in Department of Aging and Rehab together in ways we haven't done before because of the master plan. So again, CDA as the lead department has had phenomenal success in bringing in federal grants because of strengthened partnerships and the commitment at every level of the administration. So big kudos to the director here for the work that she's been doing. And just and this will be talked about at some point too, probably, but we're trying to also kind of moving our aging disability networks into modern times and making more information available online. So look forward to like the next iteration of how we make services that the state providing as well as those local connections a lot more available to folks online as technology keeps moving us forward. So again, big ups. This is the last time I will probably be talking to this group in context of like another year of the master plan update because the next one won't be under this governor. And so again, thank you so much for all the work that you've done to kind of help make this a success it has been. And we really, I'm getting up there in age and long in the tooth and all, and really hope that you folks will be able to kind of impress upon, make your voices known to the person who'll be sitting in the governor's office, a year, within a year, the importance of continuing your work on the master plan together. So that's all. I probably went on too long. I'm sorry. I'm getting close to 11 o'clock here. So thank you for all for having me, and thank you for your service. I mean, obviously this is not a small endeavor, and I know you take this back into the work that you do, and again, very much appreciate you folks and all the philanthropic and other support we've received over the years in kind of making this the success that at least I view that it has been. And again, at the same time, like Yasmin and Tiffany and others have said, kind of keeping our nose to the grindstone and pointing out, where there are disappointments or things that you think that we should be doing that make the system stronger. So I very much appreciate that too. And now I'm going to shut up. So.
Oh, we hope you never, ever shut up, Fig. Thank you. Thanks for your remarks. Great. Right out of the gate, we have Melinda. And I'm going to acknowledge.
Ask me only easy questions. I haven't had coffee yet. It's 11 o'clock.
Oh, wow. It's late for that. Melinda, before your question, there's two people I wanted to acknowledge who are also joining us today. Darcy Delgado, who is the Assistant Secretary for the Health and Human Services Agency and has the Department of Aging in her portfolio and does so much of the work to advance the master plan for aging at the agency level. And also Faye Gordon, our state long-term care ombudsman. So one of many examples of the governor appointing outstanding people into leadership in our state. So Faye is joining us today as well. Now, Melinda, please proceed with your question.
Well, thank you, Susan, and thank you, Secretary Figueroa, and we appreciate the support of you and the governor on the California Master Plan for Aging. I'm the CEO of Serving Seniors. It's a nonprofit in San Diego, and we're really focused on older adults living in poverty and experiencing homelessness. And I would just like to take a couple minutes to really shine a light on both older adult homelessness and homelessness prevention.
Okay.
We really do appreciate the initiatives in the MPA, such as, looking at transitional rental assistance, the Home Safe program, and the guaranteed income. I know one initiative that this group has brought up on several occasions is really looking at shallow rental subsidies. I can share with you down here in San Diego, we've had incredible luck with shallow rental subsidies. We've had our local county, city, and numerous foundations step up and provide those. And I really think it's critical to highlight um, programs that are preventative because we know that older adults are the fastest growing population becoming unhoused. We know it's primarily economic. And I'm happy to also share with you, we actually just had our annual points in time count today. So I was out there on the streets of San Diego with my colleagues at 4 a.m. And so just to share with you just my findings, of the 20 individuals I personally interviewed, 18 of them were older adults. And some trends that we've seen is now instead of older adults being more episodic, they are now becoming chronically homeless, and their medical needs are growing more and more. And so I certainly recognize we are in a transitional phase and certainly welcome additional thoughts from you on how we can continue to educate the new administration coming in, because we do know that shallow rental subsidy programs and homelessness prevention programs work, particularly in terms of cost and efficacy. So just wanted to share my findings and our real world experience running those programs and what we're seeing every day in terms of more and more older adults losing their housing.
And I appreciate it. I know there's another question here. This is more for secretary or someone else who might want to chime in. But I think this governor's been very focused on the social determinants of health, housing being one of them, which is why we push so hard to get things like transitional rent and things like in Medi-Cal, which never have existed before, and really kind of tested them, tried to break down the boundaries between health and housing, with our federal government partners. On the construction side, obviously we have Prop 1, which is trying to build, thousands of units in terms of permanent supportive housing, which of course will also help older individual. I mean, we're trying to attack it a bunch of different ways. And again, I very much appreciate your comments, and just wanted to note a couple of things maybe that you already hadn't brought up that are also kind of housing related. Again, these things are all like, some of these are waivers, some of them can be permanent, some not, but we've really been trying to push the envelope here of how to address. So when you do come upon a person who's in the community who's unhoused, trying to find a system, whether it be enhanced care management or other kinds of things that can help transition them into more stable environments, including the housing side. So I very much appreciate your comments, Marilla.
Thank you.
Heather, looks like your turn, but I'm sorry, Director, your charge here.
Thank you so much. I'm so grateful to all of you, Secretary Johnson, Susan, and Fig, for your leadership, for your strategic creativity and leadership in this time. And it's really inspiring to see you work through all the many challenges. I also really appreciate the focus and commitment to the MPA. It was clearly an ambitious plan, and it's given a really important structure to us to weather the storms through the thick and the thin of what we've experienced. And I do appreciate the mechanisms there for ongoing input and engagement, and the ability to work both at the regional, local level and at the state level to really promote the inclusion across our state. My question is around the Rural Health Transformation Program. Congratulations on procuring that funding. I know it's a drop in the bucket of what we need, but
well, we haven't. We are still working with the federal government on the contract. So I appreciate.
Okay.
We do have an award, but the federal government has made it very clear to all the states, really, this is an award, and you got to go through the rest of the process. But yes, we were very pleased to get an award. We were very pleased to get, more than our initial allotment that we could apply for. We got some redistribution from other states, and now we're in the process of, engaging the feds on getting an actual contract. But please, Michelle.
Fantastic. Well, I just want to reiterate that our rural population is aging rapidly, and
Yeah.
disproportionately, we have complex challenges to meet their needs. And I wanted to ask about how the voice of CDA and the implementation, because I think it's so vital that we have integration of age-friendly, disability competent strategies. And I want to just get your thoughts and hear what you're thinking about that, how we'll align the MPA with that rather small but important investment as well.
Secretary, you have your expert on this call.
I do. Darcy might want to chime in here, but I think
Ms.
one thing I'll just say,
Delgado
I'll
actually
just,
has been leading this
yeah,
effort on behalf of the entire state.
Fantastic.
She
yeah,
works for Secretary Johnson
yeah.
here, and
So,
if it's okay with
yeah,
you, I'd love to be able
yeah.
to defer
I'll turn it right over to Darcy. I just want
yeah,
to
thank
say,
you.
Heather, out of the gate, though, that Healthcare Access and Information Department is the lead, and they are part of their process in that even developing the application was a tremendous amount of engagement with local communities and partners to be able to actually craft the plan, and that will continue on. But Darcy, I would love for you to add on to that. Thank you.
Thanks. Thanks all. Heather, so good to see you. I will say that to echo what the secretary just said, the stakeholder engagement that CDA does is to be rivaled because they just do such an amazing job. HCI is doing absolutely everything they can to make sure they're hearing from folks when it comes to the buckets of these investments. So the great part of this is that their proposed budget, as Fig mentioned, that's currently under evaluation by CMS and how they're going to use those dollars. But there is a significant amount of detail in that budget available online on their website. So I'll find the link and I will post it. So what is important, I think most importantly for your question, Heather, is to say, um, what are the current proposed buckets and where do you see yourself in terms of the aging community and the disability community in each of those buckets? Because what will happen next after CMS approves the proposed budget, what will happen next is that each of those buckets will go out for bid. And so there will be opportunities for entities to be applying in, for example, accelerator funds for the hub and spoke model, because there are rural communities that we hope will be applying for the bulk of the funds, which is to say, how do we connect everyday individuals with better healthcare services? Oftentimes that is incredibly necessary in a rural setting where somebody is 75, 100 miles from the nearest healthcare facility, nearest hospital, let alone clinic, where they can receive specialty care. I will also say that part of HCI's work in writing their application that was submitted to the federal government was to examine the population that they're looking to serve. And it was very clear in examining the statistics of rural populations in California of how significant the aging population is, obviously statewide, but more specifically within rural settings. And oftentimes those are individuals who might not have the technology capabilities that others might have to just very quickly say, let's just hop on a video visit for their specialty care doctor. And so I am more than happy to help liaison and get folks to make sure folks' voices are heard within the HCI stakeholder group. So Heather, don't hesitate to reach out. You know, I love any calls that I get with you, but really want to emphasize how important it is to be tracking the different funding pots and the different opportunities for opportunities to engage in the funding awards when they come out. So I'll do a quick search and put that link in the chat. But
And Darcy,
if nothing else,
can you just add what the time frame is? When you say quick, you mean quick?
yes. So it is a 5-year program. The Rural Health Transformation Program is a 5-year program, but the federal government wants us to push out dollars quickly on a year-by-year basis. So we right now, actually tomorrow, are looking to submit our proposed budget to our to CMS and to the federal oversight entity. We have a deadline of October 2026, by which we need to have these funds encumbered, which means things are going to be moving at a very rapid pace. Because if we don't spend those, if we don't show encumbrance by October, then those dollars will be reallocated to other states. No one wants to leave any federal dollars on the table. Like you said, Heather, it is insufficient to fill the hole that all of the changes in the Medicaid and Medicare system and the hospital funding system. $50 billion isn't going to cover it. regardless, we do not want to leave any dollars on the table. So we look forward to getting all of those funds out as quickly as possible.
Thank you so much, Darcy, and I really appreciate your answer. Thank you.
All right. Any further questions while we still have the secretary and Big with us? Any raised hands?
Again, my big ups. Thank you, folks, for doing everything, for helping us with this huge, tremendous lift, and for the work that you're doing in community every day. It's more needed than ever, and I can't tell you we're these are difficult times, for both your organizations and the persons you serve. But we're here. We have to have each other's backs during this time. So appreciate your kind words and thoughts too.
Thank you, Fig. Thank you. And thank you, Secretary Johnson. And again, please, we're going to now open it up to just a conversation with the committee members. So thank you very much for being with us this morning. All right. Does anybody need a stretch break right now? Glass of water? We're going to now have an open conversation about things that we heard in the first hour of the meeting. Then we're going to move into a facilitated conversation about the evaluation of the MPA. And we have Ross Lallian joining us from CDA to lead that conversation, as well as our consultants. So let's take about 10 minutes or so. If there are any additional thoughts or impressions from this morning's conversation, Sarah's overview of notable progress in the annual report. Thank you, Darcy, also for joining us. Anything you heard from the secretary or didn't hear from Richard Figueroa?
Susan, this is Zia.
Yes,
I
Zia.
think it's important for this group, given that we're at the midpoint and we'll be getting a new administration and new leadership coming in, to start to plan for that transition, to ensure that the investments that the MPA has made and the momentum, tremendous momentum, and the tremendous work that's happened can continue. And so I don't know if you or others are thinking about that planning process, and how do we stay relevant and how do we stay plugged in? And others, please, if you have any thoughts.
Yes, this is a good time to start talking about that. Good time is in this time on the agenda, but also January of this year. Others looking across. Raised hands, just come off mute. Yes.
So I think, I think Zia's makes a good point about sort of starting the planning process for what comes next being at the midpoint. And I think, again, I want to appreciate, I know it's a lot of work to put together the annual report every year. There really is a tremendous amount of work being done. But I guess I want to note that there is still so much to be done. There is still a lot of progress that needs to be made. Older adults have the highest rate of poverty in the entire state, and that poverty rate has actually gone up over the last 5 years of the MPA. Older adults are the fastest growing group of people experiencing homelessness in the state, as Melinda very sort of eloquently laid out the on the ground experience there in San Diego, which I think really is kind of a ground zero for the problem. Millions of Californians and their family members are struggling with the cost of long-term care, and not having any alternatives besides just being an unpaid family caregiver, and really struggling with that. And so I hope that we can take the time at being at this inflection point and the fact of a new administration coming in, that there can be a honing in on the big issues that really are crippling so many people in the state, and so many these are kitchen table issues that folks are struggling with. And they're all interconnected. Even, like IHSS and homelessness are interconnected because so many people are IHSS caregivers for an older family member. When their older family member passes, they no longer have the IHSS income, and then and they're not able to pay the rent or the mortgage, and then they themselves become homeless. And that's not an uncommon story. I've heard from many people with lived experience that that is how they became unhoused to begin with. And so again, all of our work here and the issues we're working on are really interconnected. And so I encourage all of us, both on the advocacy side, but also those in the state, to really try to hone in on these big structural issues. And I know that that potentially requires new investments and new revenues and things that are hard to come by in this moment, but I think it's important that if we're focused on really meeting the big, bold goals of the master plan by 2030 and meeting the moment of 1 in 5 Californians being over the age of 65, that's what it's going to take. And so appreciate the partnership with all of you.
Very well said. Thank you. Thank you. And I really, I agree at this inflection point, the midpoint, and really just closing in on 2030. And I don't know about all of you, but there is a lot of noise out there. And so I really do think, as you said, honing in on a few key themes or messages will be very well received because it will cut through the noise. And we're so proud. We're incredibly proud of the work, and with annual reports, of 20, 25 pages in length that don't even capture all of the great work that's happening. It's hard to wade through years of progress. So really distilling what, the theme of this year's annual report is what matters most, and really being able to lift up what matters most at this time. At this time in our plan, at this time with our demographics. Absolutely. Other thoughts? Melinda, please.
Yes, and I'd just like to echo everything that Zia and Yasmin noted. And I think just, we know now that there is going to be the newly formed California Housing and Homelessness Agency. So I do think it's critical that this team really gains an understanding of how that new reorganization is really truly going to work, how we can leverage that new agency, particularly, of course, with our housing initiatives. So definitely, want to make sure that we're really following that closely, and again, ensuring that we're leveraging that new agency, and certainly agree, particularly with Zia's point about how we start engaging during this transition, whether that's with the current candidates or the timing of that, but how do we continue with that education? So when the new administration is in place, we can hit the ground running and continue all the wonderful work that this team has done. Thank you.
Yes, and I serve Secretary Johnson as a co-chair with Secretary Moss of the California Interagency Council on Homelessness, and I serve as a member. And these are not data points and issues that have been elevated to that group. Some of what we're discussing here from the community. So I agree there's opportunity and there's tremendous potential with the new structure to really get focused on homelessness and unsheltered people who are unsheltered. Okay. Others, I'm scrolling to see, and then we're going to turn it over, I believe. We'll turn it over next to Ross. Is that right?
I think so.
Yes. Okay, Ross, welcome. Ross is going to lead our next segment. I think many of you know Ross Lalian, who is our Chief of Research, doing a phenomenal job at CDA, and is responsible for, he and his team responsible for a lot of great work. I think one of the best tools that we made available in the last year that I have heard are being used for lots of advocacy, federal advocacy, state advocacy would be our county fact sheets. And one of the data points we do lift up there on the fact sheets is the cost of house, the percent of rent burden held in each community in our state. And Ross and his team developed those, as well as so many other great tools for CDA. So Ross, please take it away with our partners, Lori and Miranda.
Thank you, Susan. Good morning, everyone. Excited to be here to introduce a project that we just launched. This is our MPA midpoint evaluation. I'm joined by Miranda Kunkel and Lori Peterson from Collaborative Consulting, who we're partnering with on this effort. Miranda, Lori, and team are highly skilled researchers with deep knowledge of the MPA landscape. So we're fortunate to be working with them. And in particular, they bring extensive experience in qualitative data collection and effectively communicating qualitative findings. That's relevant today because the evaluation framework that we're presenting is largely built around gathering stakeholder feedback on the MPA implementation process. This being a midpoint evaluation, we feel like this focus really gives us a unique opportunity to reflect back on the past 5 years, what's worked well, where can we improve to help guide implementation over the next 5 years. And so this slide outlines the high-level goals of the midpoint evaluation. As I mentioned, a key focus is on the implementation elements and gaining a clear understanding of what's working well and where improvements are needed. Miranda is going to provide more context on this shortly. But this evaluation is really about taking an honest look at the MPA implementation process to date. So we're not looking for a product that tells us that we're awesome, we've done a great job. We want to hear candid stakeholder feedback, even if that means having some of those uncomfortable conversations, because that honesty is essential, right? If we're going to build upon the work completed so far, raise awareness of the MPA, and really strengthen commitment across the network of partners and stakeholders as we move into the next 5 years of MPA implementation. The last thing I want to mention before I turn it over to Miranda is to want to thank our MPA Foundation partners for their funding support in this effort. The MPA is really that all hands on deck effort and a really strong example of a successful public-private partnership. Our foundation partners have been instrumental in their support and collaboration. And in the spirit of the MPA, we're really leaning on our broad network of public and private partners to help lead this midpoint evaluation, which includes impact committee members. So these perspectives, your perspectives, will be at the heart of this effort as we learn and move forward. So I'm happy to help answer any questions at the end of the presentation. But Miranda, I'm going to turn it over to you.
Thanks, Ross. So Ross just covered really eloquently and succinctly why we're conducting this midpoint evaluation. And if I can get the next slide, this next slide focuses on what we are evaluating. And just to provide a few points of context, sort of in how we arrived at this specific draft framework. So midpoint evaluations are really valuable because implementation is still underway. In the case of the MPA, there's still 5 years left. So it's a really great opportunity to sort of step out of implementation, look at what's happening and say what's working, what's not working, what shifts need to be made, course corrections over the next 5 years. What's also true about midpoint is that at this particular point in time, especially for an initiative that's as large and complex as the MPA, we wouldn't expect to see much movement in large population level outcomes or impacts yet. So because of that, we have made sort of a very intentional decision to focus on a process evaluation that looks at the inputs of MPA implementation. So these are the elements that largely sit within CDA's sort of domain of influence. And if are functioning as intended, they create the conditions for long-term, successful outputs, outcomes, and impacts down the line. So to structure our implementation elements, we are adapting the 6 key components of an MPA, which is a framework that was published by the Center for Healthcare Strategies in 2024. So what you're seeing on the slide here are CHCS's 6 components, which CDA and the collaborative consulting team are actively defining and tailoring to reflect the California MPA context. So I'll briefly walk through these 6 components just to sort of introduce them and kind of how we are starting to define these elements. So first, state leadership. This includes how aware, committed, and invested state leadership, including the governor's office, legislative leaders, and others, are in advancing the MPA. Second, cross-agency development and accountability. So this focuses on how CDA and state partners share ownership, roles, accountability, and how they collaborate or partner on different MPA activities. The third one here, so this is not just is stakeholder and consumer engagement happening, but how is it happening? Is it broad and meaningful and accessible? And how is the input being gained from stakeholders being used in decision making? Fourth, data-driven. So this will look at how data is being collected and how data is being used to track progress, inform decisions, identify gaps, and address gaps through data. Fifth, living document. So this refers to the adaptive nature of the MPA, how it is not just a static document, but it is being revised, updated, refined, and sort of how helpful those refinements are. And finally, having a broad focus on aging throughout the lifespan. So this includes the extent to which implementation reflects a lifespan approach. So recognizing that the MPA helps everybody. It's not just for older adults. It includes people with disabilities, family caregivers, the direct care workforce, and intergenerational, future older adults. So this is just a snippet of how we are starting to define these elements. Next slide, please. So having covered the why and the what, this slide starts to get at the how. So for each of the 6 elements from the previous slide, we will be evaluating them systematically with a consistent set of evaluation questions, again, applied across those 6 elements. So this table you're seeing shows what those drafted evaluation areas are, and then the broad questions that we're hoping to answer. So first is fidelity and progress. We're hoping to answer questions like, how is implementation progressing? How is it going? Are the elements being carried out and functioning as intended? Second, we want to understand both the positives and the negatives. What barriers and challenges are hindering MPA implementation, and what factors are making implementation easier. Third is perceived value and awareness. So here we want to understand the unique value that these implementation elements have, and what would be lost if they no longer existed. And finally, and this is again really where a midpoint evaluation shines, we can ask what recommendations for improvement do stakeholders have, and how can these elements be continually refined to better support progress and success. So in order to answer these questions, we will be using both primary and secondary data, which I will talk a little bit more on the next slide, if we could go there. So this is the when. This is just a high-level timeline for the evaluation. And as you can see right now, we are in the very early stages. We are in month 1 of a 9-month project. So we're currently in sort of establishing the project foundation, where we are defining what the evaluation is and what it isn't, finalizing our framework, and then completing all of the design and planning elements needed to move forward. The core of conducting this evaluation will really be happening in phases 1 and 2, stakeholder engagement and data review, which will run concurrently, as you can see. So on the stakeholder engagement front, we will be engaging stakeholders who can speak to those 6 components of MPA implementation and help us answer our evaluation questions. And based on the stakeholders, we will likely select a mix of one-on-one interviews, focus groups, surveys, just depending on what's most appropriate for the stakeholders. This is also a key point in the project where the impact committee will be really instrumental, being able to provide some input in these evaluation areas. So to complement the stakeholder engagement data we will be collecting, we are also going to be reviewing secondary data. So this could be a qualitative document review to look for examples or evidence of the elements of MPA implementation sort of happening well and that are relevant to our evaluation areas. We will also be looking for opportunities to quantify progress in these areas where possible, whether it's dollars invested by the state or just different measures being collected and reported that we can use. And running these phases sort of in parallel concurrently will allow us to continually cross-check and validate both what we're hearing from stakeholders and what we're learning from our data review. So the latter half of the project focuses on analysis and synthesis and sort of next steps. So in phase 3, the input gained from stakeholders and secondary data will come together into kind of our formal evaluation report and recommendations. This is still many months away, but at this point, we know that we will be prioritizing deliverables that are succinct, visually appealing, and that can be shared across various stakeholder groups, with a key audience being the incoming administration. In the final phase here, the CDA and collaborative consulting teams will be reviewing the results of the evaluation and, again, the value of a midpoint evaluation, talking about potential changes based on what we learned, what can we refine, and kind of set up for success for the next 5 years. So we'll spend several months on those refinements and sort of all in an effort to amplify potential progress and impact that the MPA implementation can have. Next slide, please. So I know that was a very quick run through, so I would like to hear what's coming up for the group, just if you have clarifying questions, reactions, comments.
Miranda, thank you for this very comprehensive and very informative. I really appreciate what you've presented here. One thought that just comes to mind is sort of, are we through this evaluation, are we also assessing the level of awareness and that of the public as well as the consumers throughout California about the work of the MPA and its focus areas?
Yes, I do think there's I'll sort of provide a brief answer, and then Ross or others, if you want to add in. I do think that awareness being sort of one of our key evaluation areas, and consumers and the public being one of those key groups, I do think that would be included.
That's what that's a great question, Rigo. I think the way we get there is through our stakeholders right at the interview process, with their stakeholders on the front lines, providing those programs, interacting with them to find out kind of their sense on that, because it's hard to really understand if the broad public's aware, but I think we can through our stakeholder interview process and collecting that qualitative data.
Yeah, Russ, I appreciate that because I mean I think I would hope that we'll get very strong response from the actual stakeholders because they are engaged one way or another. But I'm really thinking about as we truly assessing, how much of an impact have we made within the general public and the general consumer who are not, connected on a daily basis or even sporadically with this work. Because I think it's sort of, I think that's part of also the success is really making having an impact in terms of how much the public knows about this, is aware about this, and sees the value of it, so that we can depend ultimately on the support just beyond the the usual stakeholders, if you will. So that's why I would think it would be important if we're not quite capturing it now. It's kind of thinking about how do we do that well.
Mm-hmm. Yeah. Rigo, thank you so much for that question and for the thoughtful approach to how we might consider it. I will say that I've given this some thought, and there have been times over the past several years that I thought, what truly is the MPA itself something that the general public needs to know about, or is it the outcomes? People want to see more affordability. They want to see that they don't have to go and impoverish themselves to pay for long-term services and supports. They need a less fragmented system that's more streamlined. They need the workforce that they want. So my concern is that I don't know that even awareness of the MPA would get us to where we need to go. I think what I hear you saying, it's maybe more the outcome level impact at the population level. Like, are these policies having an impact? Or maybe it's do our community members who are change agents at the local at the local level, who are consumers, do they know about it so that they can also be active and engaged? So I don't know. I'm just throwing that out there because I do think if you all feel that the audience for this is also partly more consumers and the users of our programs and services, that's a broader kind of a broader focus that I think would require a lot of thought about how we engage it. But I see that Christina and Carolyn have thoughts too.
Thanks, Sarah. I actually really appreciate what Rigo is saying, and I've been thinking about this too because it feels like, based on my experience out in the communities, there are some communities that are very much engaged. They've created their own local MPAs. They're doing things in their community, and then there's still several that have no idea that this is happening. And some are trying to catch up, and some don't see it as a priority, even given the upcoming demographic changes. So I get what you're saying, Sarah, about outcomes, but I also think there does need to be some sense of awareness because there is a belief among some that California isn't doing anything to prevent things from getting worse. And I think that if there was some sort of awareness and we could show maybe the coordination that has happened between local communities, agencies, any and everybody, I think mapping that out could be really helpful to see where have we really made an impact in California versus maybe need to do a little bit more work. I appreciate Rigo's comment.
Carolyn, I see your hand up next.
Thank you. I'm going to ditto Christina's words. Not surprised that we're right in alignment on this, given our background fields. I would voice from a coalition level, being the chair for the DAN coalition for the last 8-9 years, that the awareness is a continued piece of this. Because just this last year, one of our 4 top major populated counties came to the table at a local level at our rural MPA coalition meetings. And as a result of coming in at that local meeting level, raising the awareness, it started with raising awareness with that county. And that is strongly supported by the activities on the state level, to be able to direct them to a website, to be able to direct them to a public meeting that's happening where they can get more information. That's resulted in our rural region of one of our major counties coming to the table now, restructuring at a county financial level to support older adult and disability services, something that they have never done. So there's still a lot of work out here. And this combination of awareness as well as local support, local activity, local generation of interest, it's again that collaborative spirit that is critical to the continuance here.
It's a quick follow-up comment. I really appreciate that actually now that we're talking about it, because I feel like the MPA is a signal. When I started at CDA, I didn't know about these demographic shifts, to be honest. So I think if it starts there, that like some of this data is sobering, right? There's really powerful data out there. And so awareness is absolutely critical. And we have to talk about how we capture that, right? And that kind of funnels down from the state, local level to consumers. Go ahead, Rafi, I see your hand.
Thank you. Just to be really brief, agree with what Rigo and my colleagues have been saying. And Sarah, I totally understand what you're saying about the outcomes and think that's really important as well. But again, I think awareness of the MPA, and I'm thinking of it in terms of all of the local MPAs that have come up, the grants that went out, all of the communities that took advantage of that and started thinking of the demographic shifts and developing their own age-friendly action plans and their own MPAs. Making sure that work continues and more communities start thinking through that lens. And I think the MPA is, the impetus for that. So making sure that continues and that the next 5 will be as strong and having all of this in place would be really helpful.
It's Rafi.
Yeah. This is great input, by the way. Thank you, everyone.
We have about 5 more minutes if anyone else has questions or comments. Go ahead, Sarah.
So I really appreciate this conversation so much because we basically take all these great comments and then work with Miranda and team to say, okay, so how are we gonna, put it into our process for the evaluation? So it sounds like what I'm hearing is it's not necessarily like doing a statewide poll of older adults, like, do you know about the MPA? Or it's more figuring out how the networks at the local level and with the state are broadly engaging so that this issue can be a priority for planning at the state and local levels, right? Is that kind of what you're all saying?
Yeah, I'm looking at it as more of a coordinated approach, and I'm thinking about some specific communities where had the county or city not taken action and shown that aging was a priority in their community, other people within that community that lived there would not have known either. So it's really helped and benefited when local communities are engaged and aware.
Thank you.
I saw Carolyn's hand and then Zia.
Thank you. Yes, again, I just want to ditto what's being voiced here because without the collaborative interaction, I can point blank say here at this meeting, we would not be where we are today in our rural North region. When we started this, it was a trickle. When the state got involved, when the state started backing this and supporting the conversations and supporting the awareness, we made leaps and bounds into these far rural North counties because from their perspective, we look at the hospital closures, we're a big hit on the hospital closures, we're a big hit on the loss of services. So when you take that environment and we come in at a local level, oh, we have a master plan for aging. Here locally, it's a joke if they don't see some support coming from outside of this region saying, yes, we see the challenges. Yes, we're aware. This raises the awareness to a level where it changes the activity and the focus seen on a local government level. Yeah. Nothing happens unless we get the collaboration of the local government with the state government, with the federal government. Because as we know, many initiatives are approved at the state level, but if the counties don't understand the importance of it, why they require to focus their dollars on it as well, we don't move that thermometer. It just all stays as a state proposal, as a state approved action. This collaboration and awareness is critical to get the counties and the cities, those smaller municipals to say, hey, we really require to make a quick change here.
Thanks, Carolyn. Go ahead, Zia.
Yeah, just following up on that, I think there's an opportunity to think about obviously the communities where we've had direct engagement and playbooks and initiatives, but there's also what I would call knock-on effects of the MPA that go uncaptured. Yeah, and I'll use the one example, Ross. We were approached by the mayor from San Marcos because we have our PACE program there, and they are applying to become a blue zone. And they wanted to use some of the framework and the framing around the master plan and everything that's happening around aging in the county as supportive of their application to become, age friendly or a blue zone community. So I think, and then similarly, Susan talked about how the MPA has sparked 20 more states to start to develop their plans and implement them. So if there's a way at this 5-year mark to sort of like try to capture some of that, to show the penetration and the benefits, both direct and indirect, it'll be very helpful.
I love that, Zia. Thank you. Go ahead, Yasmin. See your hand up.
Thanks. I agree with what everyone has said so far on sort of the local engagement evaluation, but I don't want to. I think that there still needs to be a robust engagement of the state activities and what's happened at the state level. That and I don't think anyone's suggesting that it wouldn't, but I just want to make sure put a plug in there. And I know that a comment was made earlier about sort of focusing on CDA's purview, and I recognize why you said that, but there's so much of the MPA and so many of the large initiatives are not necessarily under CDA's purview. And so I, to the extent that sort of the housing issue, I wouldn't want some of these things to sort of not, I know I see Sarah, you're not shaking your head, but just want to be sure that sort of that holistic,
Oh, yeah.
all of government approach is taken on the evaluation, and that it's not just where CDA had authority. Just wanted to make that
Oh,
clear.
absolutely. I think that to clarify, yes, this is about the whole of government approach. That's absolutely, because if it were just CDA, the MPA would be very little. And also wanted to note that even though we're focusing on process and how it's worked across those 6 domains, that also can mean there can be comments on the issues, like, for example, the growing rate of older adult homelessness or LTSS financing, et cetera. It doesn't mean that that isn't woven into it as part of the comment on how the process has worked. So I just wanted to clarify that as well.
See, Christina's hand up. Go ahead.
Thanks, Ross. One of the other things that I think we often forget and is really unique to California, I haven't seen all of the other states' MPAs, but the ones that I have seen, California continues to be a leader in ensuring that disability is a part of the master plan. And if there's anything we can do to show and evaluate how that has changed our work in California, I think it would go a long way. Other states were very resistant to be as inclusive as our state. So anything we can do, and you made some comments about the great work we're doing through the Alliance earlier. I love that group. Any of those things that we can bring forward, I think would be helpful.
Thank you for that. We're talking about that this morning. So very timely. Absolutely. I think we're a couple minutes over. I don't know if anyone else has final thoughts here, but if not, I think Susan, I'm handing it back to you.
Thanks, everybody. Again, very helpful input.
Thank you.
Yes, thank you. Thank you, Ross, Miranda, Lori, and to our partners that are helping to support this work. I think, just as we heard, California is one of the first out of the gate with our master plan for aging, now multi-sector plans in so many states. And I think we will be one of the first to do an evaluation. And so I think this evaluation will inform and set yet another standard for other states and the nation. So we're very excited about this work and glad to have input today, so that it's a pretty quick timeline you shared, Miranda. So I think, to get the input today comes at a really good time. So with that, we've concluded our scheduled presentations for the day. We're going to move into public comment. I want to thank every member of the Impact Committee. We heard from each of you today. This is why you were all suggested and nominated and selected by the Secretary and the Governor's Office to serve on this group, because you're all very active participants. You all contributed to the conversation, and you all brought new thinking that we need to hear, and helped point us in the right direction, made some important connections. So thank you. Thank every one of you. And first and foremost, thank you for being here today. I know how busy you all are and how full your calendars are and how much is going on in the longest month of the year. My gosh, it's still January. So that you would give 2 hours today to be here, to be present, and to participate. It means so much to me. It means a lot to CDA. It means a lot to the agency and the Governor's Office. So thank you. Thank you all. And I don't know if your practice will continue, where you'll take a look at the annual report and you'll provide some feedback to us. That's been, but releasing it today, I want to make sure that if any of you have questions about what you read, if something doesn't make sense, if you think something is missing from our annual report, we would want to be in dialogue with you about that. And otherwise, I'll turn it back to Carol, who will lead us in our public comment. And a special thanks to the 100 members of the public who've joined us today. And we hope to hear from all of you now. Carol, go ahead.
Thank you. Here we go. I am not spotlighted, so let me get myself on. Thank you. This is our public comment period. So I see we have a few hands up. Just letting you know that to attend by, if you're attending by phone, it's star 9. If by the Zoom webinar function, you have a raised hand. So we asked for 2 minutes, and I'm going to get right into it. Tracy, you can unmute yourself. Go ahead.
Hey, so thank you. I am Tracy Stacy, and I am the last. Oh, we don't need the last 4 digits. I do 9805 is the last 4 of my phone. I work with choice and aging. So many of you probably know our fearless leader, Debbie Toast. She's amazing. We're lucky, but our program is previously a Prop 63 program, a PEI program for older adults. And listening to Kim and then one of the other gals who was talking, that theme where she had said that many counties have embraced the Master Plan on Aging, for example, but some have not. That same unfortunate paradigm is happening with Prop 1 and the confusion. And so in this group of advocates, I would just love to ask you or like implore you to recognize that seniors across the state are probably going to be left very much they're being marginalized or being cut out altogether. And unless the state kind of kicks in like you guys have in this process and given more technical support to counties and understanding of how to disseminate dollars in an equitable, ethical kind of way, actually, to include older adults and the nuance of care that they need, especially in the behavioral health space. A lot of people are going to be without care. The safety net is going to have gargantuan holes. And so all this work that's happening on one side is going to be undermined on the other side of the house in the behavioral health space because it will spiral everything, right? Because we support, for example, many IHSS clients, lots of like people running through APS, lots of people going through our area agencies through information assistance, for example, or ADRCs that need case management to like successfully live independently in the community, right? And not use crisis services, whether that be truly suicide prevention or just not breaking a hip, getting the care they need, being a good care receiver and keeping their IHSS caregiver because they're sacred, right? And hard to find right now. All those kinds of things. And programs like ours are probably going to die. Like we may not have a program after the end of June. And at the expense of seniors, like specifically in Solano County, there is no other program. And I'm sure there's counties across the state like us. So there you go.
Oh, thank you. We appreciate your comment. We really do. I'm going to go to Harriet. Please go ahead.
Great, thanks. My name is Harriet Arano, and I have had decades of experience in research on aging, well aging, and aging with disability as well. And this is not a criticism, but I think you have levels of engagement, and sort of the information about the Master Plan on Aging, which I love, and age-friendly movement, which I also love and am engaged with. It's only recently that that information about Master Plan for Aging has been sort of trickled down to my level in the state. And I think in terms of the evaluation or the process evaluation, this is a comment that has to do with the public knowledge and public information about the MPA. I think that in terms of a process, at this point, one could look at the Impact Committee has representation of several statewide communities, AARP, SEIU, UCs, and these are ways in which the MPA information can be brought to the public. I mean, I watch AARP webinars. I'm an old person. And I think that this would be one way of both getting information out to the public when you don't have to look at outcomes and evaluate outcomes at this point, but just the raising of the awareness will raise the support and the expectations of the public, which will drive the movement to actually make these changes. That's all. Thank you.
Thank you, Harriet. Pardon me. Hi, let me go to the next is Tatiana. Please go ahead, Tatiana. You can unmute yourself, I believe.
Thank you. Yes, I'm with California Health Advocates, and I just wanted to give a little kudos. We recently met with Dr. Oz, preceding our Senior Medicare Patrol conference in Palm Desert, and he is very aware of this, of the scams that are happening, particularly in Southern California with hospice. So I just want to make sure that everyone who has an ability to reach out to their elders in their community, there is a big fraudulent effort to put people on hospice, and now they cannot see their doctors. Through our Senior Medicare Patrol project, we're able to, if they report it, we're able to undo that. But that is a real big problem. Unfortunately, the scammers go to communities where either they're isolated or limited English proficiency. And so I just have to make sure that all of you are aware that seniors are being scammed, and so is the Medicare system and the Medi-Cal system. Thank you.
Thank you, Tatiana. Okay, we have Julie Hendrickson. Your line can be unmuted. Go ahead.
Hi, thank you very much. So my name is Julie Hendrickson, and 5109 is my phone number, but I think I'm on by Zoom.
Yes.
I thank you so much. I was my father was in assisted living for about 18 months. I'm a nurse by trade. I was a Navy nurse. I did home health and hospice afterward, and didn't have much exposure to RCFEs. But helping my dad as a caregiver for about 3 years, he was looking for more independent options, and so we got him into assisted living. And boy, did I get an education on senior advocacy. Somewhat aware of it in SNFs as well, but it's a similar situation. And so probably about 6 months ago, I went looking because I learned about the MPA, and I went looking into it to see how community care licensing was mentioned and how they were rolled into this initiative. I realized that not all, aging people are in RCFEs or SNFs, but there are a number. And I have found that regulatory compliance and enforcement, is a challenge, and it needs to be planned for properly. And I'm very interested in learning more about that. I'm hoping I have applied for a couple of subcommittees. I'm very active with the ombudsman. We're meeting again to see about creating some type of pilot to support family councils. We started creating family council at the facility. We're looking to work with the ombudsman on raising awareness of family councils at other facilities. But I wonder, is that, I'm interested, is that a topic that's come up at all with the MPA, or are you?
Sorry about that.
Engaged with that?
The short answer is yes. However, we're happy to take your comments and your thoughts back with us, and we will distill all that. And we appreciate what you have brought forth, both on a policy level, but on a personal level as well. We do appreciate that.
Thank you so much. I appreciate you all.
Thank you, Julie. So this is our public comment period. Oh, it is 12 o'clock. We do not have any more hands. Susan, I'm going to turn it back over to you.
All right, Carol, thank you. Jackie, thank you. The entire CDA team, thank you, thank you, thank you for preparing for this meeting, finishing on time, getting all the resources in the chat, and delivering today a fantastic 5th annual MPA annual report. So please take a look at it, share it on social media. We have a social media toolkit for all of you if you'd like to pick that up and use it to help get the word out. We heard that as a theme today. More people need to know about this fantastic work and to be brought in as champions. So thank you all very much for joining us today, and we look forward to seeing you next on May 28th. Have a good day.
Thank you for joining us.